Hello, my name is Victoria Wanchaleng, and today I go to talk about physical therapy referral from primary care for acute back pain with sciatica.
Definition: Sciatic is a term used to describe a set of symptoms caused by an underlying medical condition. It's not a medical diagnosis. Sciatic refers to back pain caused by a problem with the sciatic nerve. This is a large nerve that runs from the lower back down the back of each leg. When something injures or puts pressure on the sciatic nerve, it can cause pain in the lower back that spreads to the hip, buttocks, and leg. Up to 90% of people recover from sciatic without surgery.
So back pain is a very common reason for an individual to visit their primary care provider. A number of patients who have back pain also have symptoms of sciatica, which means pain radiating into the leg. Those patients tend to have a worse prognosis than individuals who have back pain alone. Yet despite the consequences of the presence of sciatica, there are a number of very important gaps in our understanding of what to advise primary care providers to do for this patient population. Specifically, the question of whether or not referral to physical therapy at this early stage of care benefits patients was an open question when we designed this study. So we recruited patients who had just had that initial primary care visit for back pain with sciatica. We asked them to either take a usual care approach, which was to just wait and see. Many patients recover fairly quickly without a lot of assistance, or we referred them to physical therapy for 4 weeks. And what we found was that the physical therapy option helped patients speed their recovery, reduce their disability to a greater extent over the 1-year follow-up period that we included in our project. No, I wasn't surprised by the results because the importance of keeping patients active, keeping them at work, helping them to remain physically active is something that we know helps across a broad range of musculoskeletal conditions such as back pain. It hadn't been demonstrated sufficiently for this particular patient population, but what we found is very consistent with a lot of other recommendations for patients with various musculoskeletal pain conditions, that activity, exercise can be beneficial and that physical therapists can help to provide that care. This is a really common population of patients, and what to advise early on to patients with back pain and sciatica is something where there's some confusion because there's been a lack of research studies that's examined this particular type of back pain. And we think it's important that primary care providers and that patients understand that physical therapy can help them accelerate their recovery, assist them in regaining their activity levels, and overall help to provide assistance in regaining their quality of life when it's provided early on in an episode of care.
Applications in physical therapy. Physiotherapy can help reduce inflammation and pain, improve physical function, and prevent recurrence of sciatic symptoms. Plus, your physical therapy program may teach you how to improve your posture and often include a home exercise program for long-term improved physical health.
Hi, my name is Jasper from Milton Chiropractic Clinic, and today I want to show you 3 exercises for sciatica. Now, sciatica is actually a pain which travels down the back of your leg, the back of the outside of your lower leg and the outside of your foot, and it's caused by compression of the sciatic nerve. And the compression often takes place in the lower back. Now, it might sound a bit strange that you're getting a leg pain where the cause of the pressure is actually in the lower back, but it's not that dissimilar to you hitting your funny bone just at the right angle and experiencing those symptoms in your fingers. So the first exercise we're going to do is called neuroflossing. And what we need to do for that is we're going to straighten the affected leg and put the foot up, and at the same time we tilt the head backwards. We'll hold this for about 5 seconds. Then we'll bring the head down, bend the knee, and relax the foot. Do this again, at the same time. Now, it's perfectly normal to experience a bit of pain in the back of your leg, but you shouldn't feel a back pain with this one. And come down again. Okay. Now, I want you to repeat this about 10 times and do this in the morning and in the evening twice a day. Second exercise is a bit more advanced than the first one. So what we're doing is sitting straight, knees straight and feet nice and up. Make sure your knees are extended and stretched out, straightened out. And now we're going to place the hands behind our back and we're going to arch our back. I'm going to hold this for about 30 seconds. Make sure everything is nice and upright, nice and tight there. And we're stretching out this whole sciatic nerve. Now, again, it's allowed to feel a bit of pain in the back of your leg. No back pain though. Okay, and slump, all the way slump. Same thing, hold this again for 30 seconds. So it's 30, and upright again. Okay, the last exercise, we're doing the same thing. We're keeping the feet, again, firmly pushed against the wall. Knees nice and straight, but now, instead of the hands behind the back, we place them at the back of our head, interlock our fingers. We're going to put a chin on the chest, slump, slouch all the way down, and then bringing the elbows in. And we hold this again for 30 seconds. You're allowed again to have a bit of pain at the back of your leg, but no back pain. And come up right again, elbows out, and we do it again. We're going to slump down, elbows in, feet nice and upright, held against the wall, 30 seconds, and up again. Brilliant. So you should do these exercises about twice a day, morning and evening, and it should give you a lot of relief. I'm Jasper from Milton Chiropractic Clinic. Thank you very much for watching.
Pros and cons. Pros. To help prevent sciatic and low back pain, we recommend consulting a physical therapist who can prescribe a strengthening program using techniques to isolate and strengthen the appropriate muscle groups. Cons. Common medical conditions that may cause sciatic include a hernia, lumbar disc, lumbar spinal stenosis, lumbar degenerative disc disease, general degenerative change in vertebra or disc, spondylolisthesis, muscle spasm or inflammation of the lumbar or pelvic muscles, sacroiliac joint dysfunction, rarely tumors, blood clots, or other conditions in the lower spine may cause sciatica. Issue applying in Ecuador. Overall, 56% of women and 43.5% of men report back pain. Among both sexes, back pain and discomfort were significantly associated with awkward, repetitive movement, and prolonged sitting or standing. The strongest associated were found among women. Therefore, monitoring ergonomic posture and developing a special program for addressing back disorders and sciatic nerve are needed. Conclusion. The physiotherapy treatment for acute back pain with sciatic aims to solve the cause of low back pain, restoring the proper function of our entire body.